Don't judge. We're not judging here. Free space, safe space. This is what this is. All
we
right.
listen and we do not judge.
Hey guys, welcome back to the AA Skin Babes pod. I'm your host, Lena, licensed esthetician. I have Heather, who is...
Hi, I'm Heather Taylor, nurse injector.
And Kristen.
Hi, I'm Kristen Sanborn, and I'm a licensed esthetician.
And we have a very special guest with us, Miss Lauren, who is with Leawood. What is your job title? What do you do?
Thanks for having me. I'm a facial plastic surgeon. So I specialize in cosmetic procedures, basically from your hairline to your collarbones.
So not
Not
it?
whole body plastic surgery.
So not
just
plastic
face.
surgeon.
I'm a facial plastic surgeon.
Okay,
So
awesome.
plastic surgery, but of the face niche. Yeah.
And where is Leawood located?
We are in Leawood, Kansas, a southern suburb of Kansas City. We're on 135th Street, not too far from where we're recording today.
Really? I didn't know that. But I also get lost,
We got
I
lost
don't-
to the parking garage.
I can't
so
go to
please.
Belton without turning on my GPS. And it's literally one highway.
To Belton.
Girl,
Lena. Oh my gosh.
don't judge. We're not judging here. Free space, safe space. This is what this is. All
we
right.
listen and we do not judge.
Well, Heather watches TikTok. Talk tick.
Right.
So let's get into this. Okay. No more side notes on the TikTok. Okay. So, Miss Lauren, what is your favorite procedure to do?
Probably a facelift. That's what I most commonly do. So my typical schedule is surgery Tuesday, Wednesday, Thursdays. And most Tuesday, Wednesdays, and Thursdays, I'm doing a deep plane preservation style facelift. And we could get into the intricacies if we want of what that all means.
Yes.
But we're essentially lifting up the fallen midface. We are lifting the fallen jowl. And then the neck, we are lifting, but we're also sculpting and removing some of that bulky stuff that we tend to accumulate under our jawline. That's done in our operating room with the patient fully asleep under anesthesia. It typically comes with a few a la carte items with the steak entree. So people will often get a brow lift in association with that, or a upper or lower blepharoplasty, or they'll have me laser their skin off at the same time.
I say, do you have to add it on?
Yeah, it's very much a la carte, like a nice
Yeah.
steakhouse. And so today was actually rare. We just did a deep plane face and neck lift. That was it. But far and away, that's my favorite procedure to perform because people want to look like themselves. They just want to kind of scoot the clock back a few
Mhm.
years. When people want to look different, or they come in and they say, I just don't like the way I look at all, I never have, I say, this is really hard.
Mhm.
You know, the perfect facelift candidate is someone that, depending on their age, their genetics, their lifestyle, is anywhere from 40s to sometimes even into their 80s. And we're just refreshing them, which is my favorite thing to do.
I think that your social media is awesome. I
Mhm.
send all my clients to go look at her social media.
I say
if
we
you
do
want
a
to get
lot
to
of
know
referring.
Lauren,
Oh, yeah.
just go and look at her social media, and then that'll just kind of tip you off on what she does and how good she is, because the befores and afters, and then you explain it, and then your whole personality is out there, and I
Yeah.
love that about you.
Oh, well, you guys that's a huge compliment from other women in the industry. So
Yes.
thank you.
And I just love how conservative you are. Nothing that you do, your before and afters are amazing. And so just seeing your facility in person, knowing you, seeing your work, that's why I am always so comfortable referring people to you, because I know that they're going to be in good hands.
Good hands.
So,
And
yeah.
yeah, and I think social media is wonderful. I also like to remind my patients that it is a highlight reel,
Mm-hmm.
Mm-hmm.
right? This is major surgery.
Yeah.
There's huge risks involved. And so why everything looks perfect and pretty on social media, there are lots of little hiccups
Mhm.
that I frequently deal with, as you guys do too. I
Mhm.
mean, working in the aesthetics industry, you just always have to be prepared for some of the complications or bad things
And
that
also
can happen.
achievable results.
Right.
Yeah.
A lot of people
There's
come in with
unrealistic
results that
expectations a lot
Right.
of times in our industry.
Well, especially for us. I mean, they come into us basically wanting a facelift.
Yes.
And so then we're just kind of being like, well, I mean, we can do things for, like outer appearance and texture and like a little bit of fullness. But what you're asking for would be not realistic to do it in this setting. It's more of a surgical option. So
And
that's a daily conversation that we
Yes.
have with our clients.
I
Yes.
love analogies because I'm such a visual person. And so, like, I always try to, like, liken it to home remodeling in a sense.
Mm-hmm.
Like, if you're wanting a whole new kitchen,
Mm-hmm.
it's a big demo, all new appliances. Your house is a disaster for a few weeks,
Mm-hmm.
huge investment.
Mm-hmm.
Whereas if you go in for some like skincare, that's
Yep.
more like hanging some artwork on the
Right.
wall in your
Yes.
kitchen. Like, it's a little,
Repainting the walls or
yes.
something. Yeah.
So I think sometimes giving them more of like a concrete example that's not their
Yes.
face, but something more like, definitive helps people kind of understand, like, oh,
Yes.
Mm-hmm.
yeah.
Yes.
Yeah.
And I mean, we can work in conjunction
Yes.
to hit those results or even boost like the final results,
Oh, for
or
sure.
get you in a good place to go into that facelift.
Mhm.
Yeah. And I think a good question would be, I have quite a few clients that have gone through a lot of weight loss.
That's the big thing right now.
Yep.
I'm sure you're seeing that too.
What is the best facial procedure to kind of get rid of or to hide those or to get rid of those, the sagging jowls, the under the chin? What would you, if somebody's listening to here that's thinking about doing some type of procedure to get rid of all that, what would you recommend?
That's a facelift.
Just
And
a full
And
facelift.
I know, so the term facelift is a misnomer. It's not doing your whole face.
Uh-huh.
It's doing, the cheeks, the jowls, and the neck. And if you like the way you look in the mirror, when you put your hands in front of your ears and you lift up, if that's what you like,
Mhm.
when you pull back here, that is what a facelift does. Yes. And interestingly, there's been a lot of chatter in my world with patients who've had dramatic weight loss and being on some of the newer weight loss medications.
Yes.
We do a lot of fat grafting as well, where we actually
Mhm.
put volume into people's faces.
Okay.
And so often we will suck that fat out of their abdomen or their thigh and put it up in their cheeks because it's more of a permanent
Mhm.
volume. But if someone was 100 pounds heavier and they've lost all this weight, they have shown potential to be that big. And so if I graft abdominal fat up into their cheeks and they gain a lot more weight in the future, that fat in their cheek will always genetically be abdominal fat.
Okay.
And so there's been discussions like among surgeons that for those patients who've lost a ton of weight, we may be uber conservative with their fat grafting, like not
Mhm.
overdoing it
Mhm.
or even omitting it.
That makes sense.
So that if
Yeah.
they ever do gain a significant amount of weight, which nobody plans to, but life happens,
Mhm.
their face doesn't also grow.
Yeah.
Have
That makes
you
perfect
seen
sense.
just since like the Ozempic, semaglutide, tirzepatide, all of that, have you seen an increase in people coming with significant volume loss needing lower facelift?
I think that question's hard because I've only been open for almost 3 years.
Mhm.
Mhm.
So it's not like I have like a great pattern
Okay.
yet.
Yep.
Like we're just kind of steadily ticking up
Mhm.
kind of in all ways. So
Yeah.
we're still kind of learning our patterns and
Yeah.
things, if that makes sense.
I just know for me personally, they've gone through all of this. They've taken the medication. They feel great about themselves other than their face. They're like, now I feel like I look 10 or 15 years older. And unfortunately, they sometimes do,
Yeah.
because of that volume loss. But it's the amount of filler that you would have to put in someone to get them to a point where they would be happy with it is not realistic. I'm like, why you would be putting 6 to 8 syringes minimum.
Mhm.
That's a huge amount of money. And then you're still going to have to keep it up every year, So at that point,
I would
just
say
go
at
get
that
surgery.
point, you're investing that
that's-
much in filler, you might as well go get surgery
Yeah.
and get those results that you're wanting a lot faster.
Yeah.
And
Yeah.
I mean, downtime, as far as downtime goes with a facelift.
Am I allowed to say bad words?
Yeah.
Yes.
Yeah.
Okay. I tell patients that they will feel like shit for 1 week. So you will feel like shit for 1 week. You will look like shit for 2 weeks. And by 4 weeks, you won't hate me anymore.
Okay.
But true final results can take 6 to 8 to 12 months sometimes, which is wild. But it's a surgery that you are like very closely watching your progress as the patient in the mirror. Whereas if you get your gallbladder removed, you have these like tiny little incisions. You really don't appreciate the healing that's going on inside of your body.
Right.
With your face, it's totally different. So you're going to feel bad for a week, look bad for 2 weeks, meaning like you can't even go to the grocery store for 2 weeks. Like you look beat up. There are the anomalies that heal faster, but generally I tell people you need to not have any obligations at all for like 2 to 3 weeks. And then for the first week, you need help. Like you need someone to like go get you food and to help you do your laundry and, you know, just someone to help you.
So with that healing process, after that 3 week, is there anything that we can, like, if they came and been like, I want to start once the bruising, swelling is down, their incisions are healed over, is there anything we can do for those clients that come and be like, I just want to start skincare, I want to start treatments, or
1000%. It's everything is additive. Everything is cumulative. You have to be on a good skincare regimen. You should do that before surgery.
Yes.
It's just good habit. That's like brushing your teeth every day. Routine neurotoxins like Botox, Dysport, Xeomin, whatever, are going to help prevent wrinkle formation, right? Like surgery just lifts the fallen tissues. It's not going to make your forehead smooth. Fillers are perfect after surgery, like little drops here and there to provide a little bit more plump where we want. And then big skin improvements require constant maintenance. I tell patients in the perfect world, you are going to have some form of trauma to your face like 2 to 3 times a year, depending on their skin type and what they like, whether that's laser, it's microneedling, chemical peels. And then in the kind of the intermediate phase, I love hydrofacials and lymphatic massage. Or I should say, I don't know
we
if I
do
should.
too.
Yeah.
Because all of that is going to help with like the little finite areas that are still swollen. And that's, you know, several weeks out.
So like a couple months after they could start doing
Getting back on a
those-
schedule.
Yeah.
Get back doing their hydrofacials, their peels, all that, they can do that. So like you would recommend give it a couple months.
Yeah, it really depends on the patient. Now, in our office, we they're like my little chicks in the incubator. So before surgery, they get a complimentary hydrofacial to like clean their skin out before surgery. And then afterwards, we have them come in for lymphatic massage for the first 2 weeks where my team is actually doing it. They're the same girls that help me in the operating room. So they know, they have like x-ray vision. They can like know where all my stitches are and everything and like how to.
I would almost
Make
always
the
feel
incision.
like, do not come to me right after. Like,
Right.
don't come to us for the lymphatic drainage afterwards. Go back to her. She
Yeah.
knows where all that's at. She can take care of that.
Really, the first 2 weeks are the most important. I tell patients, don't do any crazy stuff at home. Don't do any crazy stuff with other people. Just the first 2 weeks, I want everything to basically just stick down and learn its new home so that it doesn't and bleed.
What about contraindications? Is there anything that somebody's going to be doing that you're like, okay, no, you're not a candidate?
Great question. There are 3 big things. So medically, you have to be safe enough for you have to be healthy enough for a cosmetic procedure. So if patients have unstable heart disease, they can't come off their aspirin or Plavix, things like that. Risk versus benefit, we should maybe not think about doing cosmetic surgery. They need to have realistic expectations is probably the biggest thing that I weed people out. I tell them I'm not your surgeon.
Yes.
I tell them that our goal, we're on the same team, our goal should be an 80 to 85% improvement from your baseline. If you want perfect, you should not have surgery. Again, back to the kitchen analogy. If you want your kitchen to be perfect, I'm hard-pressed to find any contractor that's going to say everything will be perfectly perfect when we're all done.
Right.
There will be these little things that bother you.
Yeah.
So if we can agree that an 85% global improvement is okay, then I'm okay proceeding with surgery. And then the other thing that can sometimes make surgery harder or may make us pause is there are procedures that are done non-surgically that can make my surgery harder, which I know is kind of a controversial topic between, the whole field of aesthetics. But for instance, Sculptra, I think, is a great treatment for a lot of people. But a lot of us surgeons get a little nervous when patients have had a lot of Sculptra treatments, and we say, I don't know if there's going to be any like weird scar tissue in there that's going to make surgery
Nodules
harder.
or
Yeah.
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 So those are the big three. You have to be medically healthy, you have to have realistic expectations, and then we have to have a true discussion about what you've done in the past and how that can sometimes make surgery harder or longer or limit the amount of dissection I'm able to do and or make our recovery a little bit more challenging in terms of swelling.
Mhm.
Well, I think that was a lot of great information. And I think that's a lot of questions that we hear.
Every day.
Yeah.
Every day.
Mhm.
That
When
and then
people
the
do
eyelid
ask us
lifts.
about facelifts, like,
Yep.
we don't know much, like, go talk to her, but this is what we do know.
Yes.
Right.
Okay, so I think that's all we have for today. Huge thank you to Lauren for hanging out with us today. Where can we find you? Your social medias.
TikTok, Instagram, Facebook.
Oh, fellow TikTok girly.
It's just Lauren Umstattd. My last name's a little bit tricky, but it's Umstattd, like Tom David. And good thing it's unique because you just Google me and you can
I
find
say
me.
because I got halfway through Umstattd
And it just
and it
came
was
up.
already there.
Yeah.
It's
Yeah.
like, okay, because I wasn't sure how to spell her last name either. All right, and then Heather, normals.
Yes. So my Facebook is Midwest Aesthetics Injections by Heather. And then I'm also on the Amazingly Ageless and Skin Babes websites and Facebook and TikToks and all the things.
Kristen, what is all of your lovely stuff?
Yes, I don't love keeping up with it all. Amazingly Ageless Med Spa on Facebook, Instagram. And then we have the AA Skin Babes group. We have our website, Amazingly Ageless Med Spa, and I think we're on TikTok. And Jared's got us on a bunch of other stuff that I don't know, but you can find us there.
Go to the AA Skin Babes group. I have started a little video series on the differences between like our facials, our treatments, and which ones might be best for you to book.
Oh, that's good.
Have I started? Yes, I have 2 videos out for it. So it is started. I'm trying to post that weekly, but we'll see how that goes. Make sure you go follow us on Spotify, Apple Pod, Amazon, Audible. We're on Audible now. And go make sure you like our page, our YouTube, leave a comment on anything you would like to hear. Any questions you may have, and we'll get those answered. So we will see you next time. Bye.
Bye.